Hello everyone, and welcome to the webinar. So firstly, I'd like to thank you for taking the time out of your busy days to participate in this webinar. So to introduce myself, my name is Douglas Hiscock, and I'm the Senior Product Manager at Silvercloud Health. My role is to work with our clients, our wider organisations and service users to identify aspects that need to be improved, things that need to be developed in the short term, and then looking at what is needed in the future. To give you some background, I first started in IAPT in 2009 in North East Essex as a manager within Rethink Mental Illness. I then moved to Hertfordshire Partnership Foundation Trust via a TUPE and then took up a role in the performance team within a regional NHS team. And from there, I went on to work at East London Foundation Trust as head of performance for the 4 IAPT services, which included the Pathfinder Newham, Richmond, Bedfordshire and Luton, and now I'm working at Silvercloud Health. Throughout that time, I have, as I would imagine you all have, struggled to find a way to match the needs to deliver the targets with ensuring that there is a good quality of service. Also within that time, there's been quite a big push for digital solutions, and they have become a critical part of the delivery of IAPT targets, hence my move to Silvercloud Health. Without doubt, the next expansion of IAPT services will have to be heavily based on digital platform, and at Silvercloud, we want to be your partners in delivering that future. So, the rationale for the webinar today is that these will happen quarterly and they will form an important part of our product cycle. And then what we're trying to do is bring together stakeholders and experts to explore how a digital platform can help to build sustainable services for the future. It will help to build a roadmap of products and changes to help deliver the IAPT targets now, tomorrow and into the future. So to that end, I would like to make this as interactive as possible, which with webinars, that could be quite tricky. So what I plan to do is to take 20 to 25 minutes to talk through all of the slides to get your thinking. And if you would then post questions as we go along, that would be great. We can then spend 10 to 15 minutes at the end to go through them. It would also be good if you could post ideas and suggestions for developments in the products that you can think of as we go along, and then I can have a look through them at the end and contact people as necessary, and then see if I can get them into development for future changes in the platform. So with all that said and done, so on to today's webinar and what ground I'd like to cover today. So the goals for today will be to look at how will innovation help to meet the access targets, and especially the expansion over the next 5 years, and how we can help with a digital solution to provide some ideas for that. Some look at how digital solutions can release cash to build more capacity in the services so that you can have more time to do other things, and then look at a little bit about how hopefully you can manage peaks of trust by using digital as a way of building that capacity when you need it. The hope with this is to create a space where we can develop some ideas that could help services now and build ideas for the future. So it's about trying to work together to come up with great ideas. So where do you start with something like this? So for me, I'm an ops person. I always start with the data to see what's going on. And so what I did was I had a look at as we all know, the NHS digital published data each month, and try and look at that data and see what's happening within the services. Now, as you know, this data is 3 months out of date. It's rounded up, not without a number of caveats. However, it's what the public can see, and it's published, and what I can do is have a look at it, and actually when I had a look at the data, it did make me think about things, so hopefully that'll give you something to think about as well. Also, just to reassure people, I've left out the names and have aggregated this to just be looking at CCG data level, but not with the CCG data names at all present. So first thing to say is that what's the overall target and how we're doing? And so far, it's looking great. And as you can see on this graph, the red line is the 15% access target, and the yellow line is the 16.8 access target that's due to be needing to be delivered by Q4 of this year. And as you can see, from a national level, and this is the all the aggregate level right up to the national time, it's looking good. It's looking excellent. It looks like we're there and thereabouts. There's blips in December, which is quite typical, where it's just the holiday period. And so what I thought was, okay, so that's great. Let's have a look at some of the monitoring data, because that would give us an idea of what's going on underneath. Not that you can definitely say what's happening, but we can have a look at some of the behavior that's going on in the services overall. So I had a look at these 3 data points. First of all, the number of one-off treatments that are happening, the people waiting over 28 days for their second appointment, and then the other one, which is the people waiting over 90 days for their second appointment. And as you can see, it looks pretty good. It looks pretty stable. There is a slight increase of one-off treatments, but it's minimal. So overall, it does look like these stress indicators, as I call them, do seem to be going okay. As of everything, there's a blip after Christmas, but that's normal, and we all know about that, and that seems to get back under control again. However, as with all statistics, underneath the averages, there's quite a story for some services. And so when I had a look at this, some of the individual areas, individual CCG areas, it does look like there are services that are beginning to feel the strain. Here's one in particular service, which, as you can see, is the number of one-off treatments has rapidly increased over the year, which means that maybe not as many people are entering treatment, and it does indicate that people are beginning to drop out without actually getting into treatment. The next slide. As you can see here, this service has had a particularly difficult time when it comes to people waiting over 28 days. And from February, that's gone up considerably, and waiting over 90 days has picked up a little bit. So again, there does seem to be quite a dramatic shift, and then a dramatic shift back down again as whose waiting times have got back under control. So there are some services that are really struggling. And what's quite interesting, again, going back to one of the objectives, is to look at fluctuations in workforce impacting on this. So if you look at this slide, it shows that there's quite a big increase happening of people waiting over 28 days when the level of activity at step 2 was quite low. And as that step 2 activity's gone up, it's begun to get back under control again, and just showing really that there is a fine balance between waiting lists running out of control and having enough activity in your staff levels to be able to keep that under control. And it's just one of those things to look at, and really to see that there is this tipping point that we have to maintain a high level of staff in the system. So that's how we're doing now, and clearly overall it looks quite impressive, but what is going on for some services is causing quite a strain, and at the moment those services are going to have to look at ways of trying to manage that pressure. So for the future, and where does this take us next, this is the objectives to happen over the next 5 years. So currently we're looking at the moving to being able to get to 16.8 next year, which is about 1 million people a year going into treatment, and then 19%, and then 22%, and then up to 25%. So from where we are now is another 500,000 people going through the system in one go. And that just doesn't sound like a considerable amount of people. And when you look at it, it doesn't feel like it, but it actually, what that will feel like is could be quite difficult. And as you can see here, I've taken one particular service, one particular CCG area, and looked at it again of what the increase. So that overall there will be a 67% increase in referrals coming through entering treatment. Now that does sound okay, but when we consider that a lot of services are struggling to attract that number of people in, and that it's taking probably about 30% more referrals to hit these levels when you look at the national data, what's that going to feel like? What is this going to feel like as going forward within the services? So I've taken this service and considered, okay, what will happen? So to hit the 23,000 people, you will need about a 70% crew conversion rate, means that there's around about 33,500 referrals a year needed to get 23,400 if we carry on the way we're going and the way things are. So that's around about 645 referrals a week. That's 129 referrals a day. That's 17 an hour. And that means that we would have to offer an assessment. This service would have to offer an assessment. Every 10 minutes, there would need to be 3 assessments completed or offered. It does make you think that there really isn't much future in one-to-one assessments going on, because it's just the numbers and the level that have to go through, and it's just a feeling I have, and this is what it might feel like to be in a service. So with that in mind, what's the future? So you can either increase your staffing levels, and 67% more referrals coming through, that means you need 67% more staff. Now we know that isn't realistic, and actually in a lot of places that level of staffing increase is just not going to happen. It's not going to be sustainable. Then the other idea is bigger groups. Well, that's definitely a solution. But as we know, bigger groups are quite hard to manage, quite hard to organise, and in a lot of places, finding rooms big enough to have people in there, that's quite a challenge, and it would be quite a considerable increase in groups. So that is one solution, but it's going to take a lot of organising. So the other part is that actually looking at digital within this environment is a good way to go. It's much more like touch. It's much more based on individual needs. People are going to want to follow their own way of doing things. People can do it at their own time. And it also, one of the ideas is that you can do this for people waiting for one-to-one, so people can have some support whilst they're waiting. So these are some of the ideas that we've heard about. Self-directed, minimal impact. It's exactly what IAPT needs to be able to deliver this for the next phase. So what's happening now? So this is a traditional pathway that's happening at the moment. The referrals come into a service, they get assessed, they get placed onto a treatment pathway, and that can be either one-to-one in groups or a digital solution, a digital platform. And obviously the benefits of digital is it's self-paced, that people can do it at their own time. They can do it, the asynchronicity of it means that people can carry on, and the staff member can support people when they need to, and it's self-determination, and people can feel like they're getting involved, and it's much more about I'm doing this bit of work rather than going along to a session or one-to-one session. So this is the kind of pathway that's happening at the moment, and this is the kind of traditional way of doing it. But what we're beginning to see in the emerging practice that's going on now is, as the pressure comes on to have more referrals coming through, is that people are finding their way to the website individually, and services are asking us to be able to give people access to Silvercloud as soon as they actually are able to get onto it. Because what we found is, we all know, the quicker someone starts their therapeutic intervention, the quicker they recover and the quicker they engage. So what we're being asked to do is to give people an option for self-referral, and it's being able to give that person access to the system if they are suitable for that part of the program. And we're able to build a portal which allows people to fill in some questionnaires depending on what the service wants, and then they can either be onboarded onto the platform or wait for someone from the service to contact them to do their assessment a little bit more in depth, and then come back to the digital solution. issues that have come up with this, and they're quite reasonable. And I suppose to share this with you at the moment. What people have worried about is it's opening up the front door, that they can't control the numbers coming in. And obviously this is quite a concern, but we've been able to reassure services and enable a kind of control of the numbers that actually go onto the system and switching it off if it gets too much. Again, some of the comments as well, it's too risky for individuals. Again, this is entirely in the services control. They set the risk levels for people who are able to decide what level of risk should go onto the program and those that shouldn't. Another one is the allocation, that people are worried about how to allocate, and we have a system in place which can allocate people as the service requires. It can be automatic or it can be done through a filter. So it is quite an interesting development, and we're quite interested in pursuing this with other people because it is enabling people to find access to the program as quickly as possible. Some of the other things that have been talked about are the future ideas that can come up as well, the things that we will go to next. Some of the things we're thinking about is that people being able to be assisted as they wait. So if you're waiting online, people can actually talk to you as you go along. People can help you so we can develop programs that help people when they're waiting for treatment that are tailored for them. The other thing that is quite interesting in developing is the response to your style. So as you're going through the program will develop and learn from how you feel about the program and what's going on for you, and that then can be tailored to be able to do that. The other part, seamless case management is our goal, is to make sure that the work that's being done in Silvercloud is mapped into whatever case management system you're running, to make it as simple as possible, so you are not having to do a lot of work around this. And then the other part, when we talked about earlier about the trouble with assessments, there's far too many people out there needing to be assessed. As the numbers increase, being able to drop in on people who are struggling with the program or doing an assessment online, and being able to speak to them like you would do if you were trying to get into a bank or anywhere like that. So using some of the innovations that were already happening in the real world, be able to pull that in. So before we come to the end, what I would quite like to just introduce you to is some of the benefits that we found from having people have access online. And this slide deals with that quite considerably. One of the interesting things is it's a patient, the faster the access people get, the faster they can start working. It's capturing that person at that moment when they're highly motivated and highly interested in what's going on. And people can get in, they can start the program, they can get on with it. Instant treatment for patients. If we've excluded all the risk factors, they could just get on with it. And actually someone can go in, get on with the program, complete it, and actually not need any support from anyone else. It's kind of truly deterministic. People are able to do this for themselves. The other issue, obviously, if the service wants this to be like this, is 24-hour access, 7 days a week, 365 days a year. As long as someone's got a computer, they can get on and get on with it. And actually, one supporter can support many people, because obviously people are going through at their own pace with their own motivation, so it's quite easy to do it. And it helps with access targets. If you don't have to funnel everyone through an assessment process that's very time consuming, and people are self-determined and can get on with it and they fit the criteria, they can get on with this straight away. So these are really good ideas for the online being able to access straight away. I'll come back to that one. So what we've seen when we've done this is the immediate secure access to therapy. So when people are being able to just access it straight away, there's a 98% increase in online clients being able to access straight away. And what we're also finding, there's a lot of men that are able to access it as well and are just getting on with it. So the number of men accessing CBT via Silvercloud has gone up through this, giving people open access. And the cost savings for 330 patients is about 36,000. And we are receiving recovery rates between 50 and 62%. So the standard model is being achieved through being able to provide the direct access. The other thing, just quickly, is just to give you a quick idea of the cost-saving benefits of being able to use Silvercloud. So normally it's 8-session course of treatment on Silvercloud Prep is £24 for the license, depending on your cost per volume, how many people you think you might get through it in a year. So a PWP support on Silvercloud Health is about £140. So that's based on a 30-minute assessment and 6 15-minute review sessions. So that's about 2 hours worth of work. So in total, the cost to Silvercloud for an intervention is £164. And when you compare that with the national cost, the model that's been produced that we all know about, which is £493, it's quite a considerable saving. Being able to give people access, you will get a lot more people through the system and recovered. So that's the end of the webinar for today. So now, if there are any questions, and I'll be more than happy to take some questions and give you some answers if I can. So thank you very much for listening, and thank you for your time. And thank you very much for taking your time to speak to me today.